Now, June is Alzheimer's and Brain Health Awareness Month, and as part of that, we have brought in Christine. And Christine, you're going to tell us a little bit about Alzheimer's and some of the dangers of it.
Oh, definitely. So a lot of people don't realize that Alzheimer's is actually a fatal disease. It is in the top 10 of the fatal diseases that we experience here in the United States. So June is Alzheimer's and Brain Health Awareness Month. And so we're just trying to help get the word out that you're not alone. If you're experiencing some memory loss issues, there's help out there.
What are some things that folks don't know about Alzheimer's?
Well, one is the importance of early detection. Just like any other major disease, there is a great deal of importance stressed on early detection. There is not a cure. There's no prevention. There's not even any good strategies or medications on the market that will reverse the process. But there are still a lot of good reasons to get that diagnosis early in terms of being able to make plans and in terms of maybe doing some things on your own to help preserve your brain health. So those are just some of the reasons that we really stress early detection.
Awesome. Well, Christine, what has been your experience with Alzheimer's?
My mother-in-law passed away from Alzheimer's many, many years ago, and I've worked in the mental health field and volunteered for the association for about 10 years before I became employed about 4 years ago. So dealing with a lot of families in the senior care industry all that time, and of course now all kinds of care consultations and support groups and education, things like that. You know, I'm facing people day in and day out that are struggling with the issues regarding memory loss.
What would you say is the importance of this month?
One is bringing awareness so that people will realize that they're not alone and that there are support services available and ways to participate in research and things of that nature. The association has actually partnered with the Ad Council, and we have a new campaign coming out that will be airing very soon, and the whole kind of message about that particular ad campaign is if you are noticing some changes, things feel different, it could be Alzheimer's, so it's time to talk. Because a lot of times people will wait much too long until that disease has really, reached further stages before they will seek any help at all.
So you're talking about early prevention. Is there a certain age where Alzheimer's sets in, or can it happen at any age?
We think of Alzheimer's and other dementia diagnoses as age-related, and age certainly is the #1 risk factor. However, we are seeing greater and greater numbers that we call younger onset, because we're seeing people that are younger than 65 that will have full-blown Alzheimer's and other dementia diagnoses. So we are all at risk.
Wow. You were mentioning some resources. What are some resources that we have here in Central Texas?
We have a number of support groups, caregiver support groups that are available. Nobody understands like somebody who's going through some of the same situations. And so they can get together and share ideas and in a very safe environment. And then we also have an early stage support group, which is designed for the caregiver and the person with the early to middle stage diagnosis. So very important for those folks as well. We also have educational opportunities, all kinds of things ranging from Know the 10 Signs to dementia conversations and things of that nature. And then of course we have our website, alz.org, which has just a wealth of information out there for people and different ways that people can get involved in fundraising so that we can find that cure.
Great. Thank you so much, Christine. Great to know where folks can go with questions and those resources as well. Thank you so much.
I appreciate it. Thank you.